Oh, Zalima, you did join, and we're very, very excited. We just mailed your package out today, so I'm excited. All right, cool. So guys, hey, we are now live in the 30-day EKG Facebook group. Thank you, Ruben. You are amazing. And happy Friday, everybody. So excited that we're all here. If you're with us on the Zoom, put hashtag live. If you're with us on Facebook, put hashtag live. And also, yes, as Nikki, I know, Latoya, we were just saying congratulations to you. And I think it was right before you hopped on. So Latoya, we got Marissa, and we definitely have Zalima. We're excited you guys are going to join us in the 30 days, so you'll continue on. We're very, very pleased. So, but anyway, so tonight, how we're gonna lay it out is, it's so exciting because at the end of the week, we kind of get a little draggy. So Michelle steps in to completely just rock our world with another game. And then she punts it back over to me. I share a case with you that really happened and had a very interesting outcome. And then I'm gonna finish it off with giving away more of these badges. So I actually, I wanted to show you, this is my work badge. I can't show you like my actual work badge, but it's on my badge. This hangs on, every day. So we'll be giving away more of those tonight. And I'm going to give you the hashtag to put in before Michelle gets started, so I can write your names in the bowl. Very crafty, right? Very crafty. So also, if you already did join us in the 30-day, all of the kits went out today, except for the last 2 people that signed up today. So those are on the way. If you need shipping numbers, let me know. I can get those for you because your kits are in the mail. So Michelle, it is now officially 5:30. I'm going to kick it back over to you and have you play the game. And oh, okay. The hashtag. See, I almost forgot. I always do that. Hashtag. What do you want it to be tonight, Michelle? You get to choose.
Oh, let's do hashtag maze, because this game is a maze. EKG
hashtag
maze.
Okay. Yeah. We'll put hashtag maze. Love it.
Yeah. Perfect.
Okay. All right.
You ready?
Ready.
Okay.
I'll be writing down names. Okay.
Okay, guys, I am gonna share my screen. And so this is a new game. Excuse me. This is a new game. So we're gonna see how it works. That's a little bit of noise. Hopefully that'll be the last little bit of the noise in this. And put your answers in the chat, and put them in the chat in the Facebook or on the in Zoom. And I'll bring my chat up, so I should be able to see everything. Hopefully, Jen, help me do the chat in Zoom, because sometimes it gets a little hard to read. Okay, got it. All right, so what this is I built this little maze, so it's brand new. I actually, it's completely different. But so I wanted to try it because, y'all let me do whatever I want with the game, so that's kind of fun. And what we do is we start over here at number 1. You can see the little arrow. And we're going up to number 1. So as we get the questions, we actually get all the way through the whole maze, and we get to the end where the Mandalorian is. So answer the questions, and then that'll pull us back to the maze itself. So we'll see how this works. Bear with me, because this is the first time I've done it. I mean, I played with it all day, but we'll see how it works. So normal PR interval. So I started off with pretty easy ones, right? So normal PR interval. Oh, and I already have some answers. Perfect. Marissa, look at you. Zalima, y'all type fast. I can't even talk that fast. Y'all are already typing the answers in. Okay, so the answer, 120 to 200 milliseconds. So these are just like the first ones. I try to do some easy review ones. So now that will take us back, but number 1 didn't take us anywhere. Oh no, so we have to go to number 2, because it didn't take us, it didn't open up the number 1 door. So number 2 says, the sinus node creates a P wave that is representative of what? What does the P wave, when you see a P wave on paper, what does that tell you? Yes, Ariel, atrial repolarization. Atrial repolarization. And I'm watching the chat in the Facebook too. So y'all are super fast. Okay, so the answer, atrial depolarization. Perfect. Okay, so here we go. Let's see if that worked. Yep, so that opened up the door number 2. So you kind of see down here on the bottom, I put a little heart there. And that's my little heart that I sketched. So when we do the coronary artery class, we actually do a little sketching on that. So now we're going to go to number 3. And number 3 is, if a P wave equals atrial depolarization, then what does the QRS, what is it representative of? So I tried to we're building up as Jennifer did at the very beginning. And we know what the atrium does. So the ventricle does. Yes, Marissa, ventricular and aerial, ventricular depolarization. Zalima, yes, perfect. Okay, so now, oops. See, I already did that wrong. Oh no, it took us back. Okay, so that was correct. So now we can go through the maze. So we can either do number 5 or number 6 or number 4. So I don't want to make this too long. So I'm going to go ahead and go to number 6 because I know that's what opens the door. So on number 6, what sinus node functions to create a normal conduction delay? Which node? Which node is like the stop sign? Yes, Deanna. Yes. The node that is the stop sign, the one that creates the delay, is when I get through the sinus node and then the AV node goes, wait, stop. Well, you can't go further. You have to look and make sure that the ventricles are okay. And let me look at the left ventricle and the right ventricle and everybody's good. That's the sinus node talking. So that's, as y'all can know, I hear all these voices in my head. So the AV node is the one is like the stop sign. It's the one that makes sure that everything is going well through the system. All right. So yes, we got through number 4. So now we can keep on going and we're going to go around the maze. I should probably draw a little line. That would be easy if I drew a little line instead of y'all don't see where my little arrow is going. So we're going to go over here to number 7 because we're going to keep going through. So here we have, you would expect in a 12 lead to show inverted T waves in 2 leads. And the reason why we keep going over this is because I don't think that in any EKG classes that I've ever taught or been to in the past, do we really, really look at this portion and make sure that we know that these 2 leads have inverted T waves. The T waves are not upside down, they're inverted, and they're inverted in 2 specific leads. So that is it. Yes, Roxanne and Nikki. Yes, yes. Marissa, you like the voices too? Do you hear the voices? Awesome, me too. I can hear the voices. Everything talks to me. Okay, so let me click on that. Yep, the AVR and V1. So I'm just making sure that I'm doing this correctly because it's a little bit different than what I've normally done before, but it's a new game. So we're all in it together. It's all about a learning process, right? Okay, so we're going to continue on. And do I want to go to number 8 or do I want to go to number 9? Well, I'm going to pick number 9. What do you think about this rhythm? What do you think about this rhythm? If you were to see that, and you know, I'm going to tell you that your patients had a little bit of palpitations. What do you think about this rhythm? And I'm looking on, yes. Hey, RP, you're here. Laura, you're here. Awesome. Awesome. I'm looking on the Facebook. So irregular, yes. So the patient is irregular and it's irregularly irregular. If you were to see that and you knew your patient had palpitations, what would you be thinking in your head? Would it be this patient? Alyssa, yes. Latoya, Allison, Deanna. Oh, y'all are got it. Perfect. Perfect. So this is AFib. So you would be thinking your patient had AFib. That would be your thought process on it. I would like to see it in more than one lead, but definitely that's where my thought process would be. Whoops. Let's go back. The answer should have popped up. There it is. AFib. Okay. So let's go back. Now we know we've gotten over here to the top of our maze and we can either go to 10 and go around this way, or we can go to 11. So I'm going to go to 11 because again, I know which one opens the doors. The left main artery bifurcates into the left main. Now I'm not sure if we've really gone over a lot of this, but I want to make sure that we're clear on this. And I have a little heart. I just brought my little small heart tonight. And so this is my little small one. The left main artery comes down and it splits in half. What are the 2 arteries that it splits in half to? The circ and the LAD. Yes, Jen and Allison. Yes, perfect. Jen and Allison, type that in right away. The left main artery comes down. It starts up here at the top. That little left main comes off the aorta and it comes down about 3 centimeters. It's not very long. And then it comes down the front, comes down the front, comes down the front. So I said that 3 times. So we call that the left anterior descending, down the front, anterior descending, make it easy. Thank goodness they made some words easy in this, right? And then the one that comes and circles around the heart is called the circumflex. So, okay, so we opened up that little door. Number 11 went away. So let's try number 12 and see if we can get through the maze over here. So here you have a 42-year-old male that had syncopal episodes a couple times in the last 24 hours. What is on your differential? And this is one of my favorites.
That's all you gotta know.
Yeah, it's one of my favorites. And I put V1 and V2. So it is pretty chilly in V1 and V2. So what do you think? Oh my gosh, y'all are even good. And you're even good about spelling it. I have to look to see the spelling. Oh my gosh, Nikki, Latoya, Deanna. Yes, you all have it. Yes. And you spelled it right too, Brugadas. So it's Brugadas. Yes, brr. It's cold in the V leads. Brr, cold. Okay, so we open up another little door. Oh, no, we didn't open up a little door. So we need to go to number 10 because I didn't open up another little door. So let's go back to the main arteries, the two main coronary arteries. So we know one of them because we already chit-chatted about one. What is the other? What is the other? Yes, Nikki, the left. So the left main artery is the one that's going to come off the left side. So what is the other main artery? Yes, the RCA. Yes, the RCA. That is so cool. Awesome. Yes, Marissa. Perfect, Jen. And I do, if y'all are in the 30-day, I start a class. You see, Jen does one on Monday night, right, Jen?
Yeah,
and then,
welcome call.
Yeah, and then I think Wednesday night I do the basic 12-week class, and you're gonna have so much fun because we play with the little hearts. You're gonna have like little EKGs that you're gonna print out. It's gonna be so much fun. Okay, so the left main and the right coronary artery. So let's see if we open up the other door, number 10. It should have opened up. Come on, number 10. Nope. Number 12 should have done. One of these two opened up the door. Oh no, my little door didn't open. It was supposed to open. Let's go back here. Well, that's what happens when you
Make new games.
Yeah, make new games. Let's try this again. Okay, so we're going to go to 14 because I'm pretty sure 14 opens up. All right, so what part of the heart does the RCA perfuse? So we talked about the left main coming down the front of the heart, and now we talked about that RCA. So if I think about that RCA, what part of the heart does the RCA perfuse? What part of the heart does the RCA perfuse? Yes, and y'all are all typing in inferior. Marissa, Nikki, Ariel, Jan. Yes, perfect. So that, click on here. All right, so the inferior wall, and sometimes that right coronary artery comes back and it's part of the posterior wall. So in our class, we always talk about that posterior wall because nobody talks about it. It's like a secret. Nobody wants to talk about it. So we want to make sure that we know things that are happening in that posterior wall. Okay, so click on that. So yeah, now 14 opened up. All right, so now we're going to come on over here and we should be able to, let's get to number 18. We're almost done, almost to the end here. Name that rhythm. Let's do a couple of quick rhythms. Name that rhythms. Let's see, what's your name? Yes. Oh, Asbury, you're here. Awesome. Okay, so name that rhythm. What do you think that is? Can you see that? Yes. Sinus Brady. Sinus bradycardia. Yes, y'all are getting it. Jan, Marissa. And then the ABL. Sinus. I'm sorry?
That was me. My bad.
Oh. No. So because it's so slow, you would actually have junctional as part of your thought process. But if you look at those P waves, it does look like the Ps have a PR interval. So if you march that out, and of course I would use my little calipers or my RCAT window and measure it, and I would see that those P waves, there is actually a PR interval on there. And I didn't give you the intervals on there. So that would have been helpful if I'd done that. Okay, so let's see, where are we now? All right, so we're over here. We can come over here and we can actually get over here to number 17. So we didn't talk about this, but I like you to know because we talked about intervals. So if we're talking about intervals, how do we know what numbers we're using? We keep saying, oh, it's this long, or the PR interval is 0.20 or 0.1 or 120 to 200 milliseconds. So when we look at this piece of paper, what does that mean? So when I say that, how much each one of those little blocks are, a large block goes from the dark red line to the next dark red line. So how long is that? From one dark line to the other dark line, how many milliseconds is that? How many milliseconds? One dark line, 0.04 Daisy is one of the small ones. This is the large. So you're right. 0.04 is from that dark line to the next red line. So if I keep going, keep adding 0.04, 0.04, 0.04, 0.04. So dark to dark is 0.20. 0.20 or 200 milliseconds. So either 0.20 or 200 milliseconds. And I wrote it as 0.20. You can go either way. All right, so making sure I have all that down. Yes. All right, so we got that answer. Let's come over here. Oh, my little clicker. There you are. All right, so we've got number 17. 17 should have opened. 17 is supposed to have opened. Yeah, there's a glitch in there. 17 should have opened. Okay, so we can keep going, or actually we can go around this way and we can go over here, and let's get over here to number 19. Number 19, name that rhythm. What do you think about this? Now I'm going to give you a hint. Jennifer talked about this one. Jennifer talked about this one on day 2, I think.
Day 2, yep.
Day 2, yes. Yes, day 2. Oh, Daisy. Yes, Daisy saw it. So this could easily look as normal sinus rhythm, but Daisy saw it. Tian saw it. Yes, yes. You see that little slurring upstroke, from that P wave up into that QRS, that sloping. Yes, because of the delta waves. Perfect. Perfect. So you got that WPW. So we opened up number 19. And I'm going to slip on over here since we can get on past. And number 21, we have to know these rhythms. We have to know these rhythms. What are these 2 rhythms? So I'm ending up on rhythms that we need to know. Yes, Erin, Marissa, yes, you got it. So our first one is VTAC. And what is that bottom one? So that VTAC, nobody paid any attention to, and they kept going, that's not so good. And they went into VFib. Yes, VTAC and VFib. So that should have taken us all the way to the little Mandalorian guy. So it worked out pretty good. There was a couple little glitches, but I'll keep playing with it. If y'all like it, I'll play with that one and fix it a little bit. That one's a brand new one. So
I appreciate you making a brand new game for us. That was like above and beyond.
Yeah, I started that this afternoon and made it completely brand new. So
oh my gosh. Okay.
Nobody else out there has that game.
This was super fun. Esprit says it was fun, and Nikki liked it. Nikki gives you an A+. So
awesome.
You got skills. Yeah, this is a selfie of us last year in San Antonio, so I had to put it up. Carmen, welcome in, girl. Yeah, we're gonna do this again in San Antonio this year, right, Michelle?
Oh yes, for sure.
Yes. We actually
did I stop my screen share?
Yeah,
I did. Okay.
Yep.
Okay. Thanks.
Jan says anything that makes the heart fun is amazing. Well, stick around with Michelle because she's got hard voices. She's got like all the things, where to put the leads on. I mean, pillows, cameras, everything. So
yeah, we'll be back to Skelly on Wednesday.
Yeah, Skelly on Wednesday. So anyway, guys, I'm going to give the badges away at the end. I got your names in the bowl, thanks to Michelle. And that was super fun. Well, we're going to do night 5 and we're going to wrap up the official challenge with a case. So it's a very interesting case, one that is very timely. We've had a lot of that lately, timely. You guys can probably hear Remy in the background. Yep, sorry about that. Remy. Oh my gosh, I'm sorry. But we do have CE that is good for medics, EMS, any EMS, RN, or PA or NP. Okay, so you do have a link. It is up in the top of the group under, Remy has a lot to say. It's in the top of the group in the featured post. And if you just fill it out, give us like a couple day turnaround and we'll get you your CE, but you do get CE 2.5 hours for coming to the challenge and watching the videos. Now they are based on, the CE is based on the recorded videos. So that's why we put them on a replay page and we put them up in the guides so that you have access to them. And so yeah, get your CE and why not? You came and put in the effort and we appreciate you being here. So we like to reward you for your time. So anyway, this is our case of the night. Now, this is not anybody's real face, but this was a real case that happened. And this lady came into the urgent care, okay, in the urgent care. And this was, she was not grabbing her chest, but she was complaining of a dry cough for 1 week. Now, if you work urgent care, and I think Zulima, you work urgent care, so you'll appreciate this. So Nikki says, is it an ACE inhibitor? Love that you thought that, Nikki. It's funny because usually our first thought is it COVID? And then the next thought is, are we giving a letter in the clinic, right? Without COVID testing her, she might not even get in the clinic. But anyway, this is way before COVID, so we didn't have to think about that. It wasn't on our radar. And she said, I need a Z-Pack. That's what people always say. Well, actually, that's changed, right? Since COVID, now people say, I need a COVID test. And the Z-Pack isn't like the cure-all magical pill anymore, which is great. And she says, oh, I'm a school teacher. One of my kids probably gave it to me. You ask her if she has any history. She says, no, but I work with toddlers and they all are sick. So it's got to be that. Okay, all right. What's common is common, except for what's not common. In fact, we always have to think about the zebras so that we don't ever have this face of you missed something. So these are zebra glasses. Actually, one of our students sent them to me. They're super cute. They go with my zebra cup. Thanks to Asperie, if you're still here. But you never want to miss something. So this is what happened. Okay. They said, well, let's get a chest x-ray since you've got a dry cough. And you're not on a, I know, super cute, right, Tori? You're not on an ACE inhibitor, although good thinking. And you don't have a fever. You don't have any production of cough. So, or sputum. Let's get a chest x-ray. Let's just make sure you don't have a pneumonia. She's like, okay. So they get an x-ray and they say, oh, wow, you've got some stuff on the left side. I think it's a pneumonia. You got to go to the emergency room. Okay, Zalima, that's never happened to you ever, right? Duration of symptoms was 1 week, and that's also a little concerning. Although that virus that was going around in November, December was lasting like 4 weeks, and people were getting really concerned. It wasn't COVID; it was another virus. John and I had it, so I know. Anyway, so there's Remy again. So the first thing when they said go to the ER, she gets triaged. And the first thing I want you to notice about her is that the nurse got an EKG. Now, what I will tell you is that the nurse was the one who really saved the day here. So anybody who says, oh, I'm just a nurse, I don't need to know this, or I'm just, whatever, like, no. Anyone on the team, we all need to know this, no matter what our profession is. And it was because the nurse got an EKG that, hi, Remy, I know he says hi. So because the nurse got an EKG, I believe that this patient's life was saved. I do, I really do, okay? So I want you to notice her heart rate. Her heart rate was 109, and that's high. Of course, could that be because she was sick and volume depleted? Sure, but could it be something else? So think about the tachycardia here. Okay, think about your differentials. Would pulmonary embolus be on your differential? I would hope so, because anytime you have a density on one side, it could be a PE. And tachy, we always think about PE, okay? But there's something else going on that the machine is saying. It says she has a non-specific ST2 abnormality. Could be a little effusion. And actually, Marissa, she did have an effusion. It was in her lung, actually, and it wasn't a PE and it wasn't a pneumonia. So good pickup. And Daisy thought about PE. Deanne says, I'm an RN who caught ST elevation and sent the patient to the cath lab. See, this is what I'm talking about. Okay, doesn't matter who we are on the team. We all need to be responsible for knowing these things. And strong work, Deanne, by the way. Good pickup. So I just want to, Jermaine. Wow, Jermaine, we got to talk because you are, wow, you're on fire over there. Love it. So here's the thing. If your machine software ever says this thing, I don't know if you guys remember, but in day one, I told you the thing that scares me the most is when the machine says non-specific ST2 abnormality. There is at least 5 things, actually 6 things, at least, that live in this phrase that can kill a patient if we miss it. Posterior MI is one of them. Wellens warning is one of them. So all sorts of De Winter's T waves, okay? All of these things can live in this non-specific blanket. So that non-specific blanket really, really, really scares me, okay? Because it's honestly almost never non-specific. I just actually wrote an article for an urgent care journal. It was published, I think 2 weeks ago, about this finding actually. And you can Google it. I think it's called Urgent Caring is the magazine. You can look it up. But this patient, as Jermaine just caught so astutely, has one of the things that is dangerous. And I'm going to show you what it is. So as Michelle mentioned earlier, if you were listening, it was like yesterday, Michelle said, oh my gosh, AVR is my best friend. AVR is my best friend. And here's why. I believe that Michelle is onto something. That the AVR in this EKG is what saves the day, because the patient has 1 millimeter of ST elevation. And that in and of itself is problematic. But when you combine that with also the widespread ST depression that Jermaine so astutely pointed out, hence another reason to always look, you guys, always look at the tool. This is literally why I have my RCAT window badge on my badge, because I'm always looking, okay? And this patient has what's described as diffuse ST depression in 1 AVL. I didn't draw the line exactly right, but in V4, V5, and V6. And there's also a little in AVF. Combined with the elevation in AVR, this is what a left main occlusion usually looks like. The very best case scenario is a left, or an LAD, a left anterior descending occlusion, high grade proximal. Either one of those things is a very bad thing and needs to go to the cath lab. And there was just updated guidelines that were put out in November that says this should get urgent, not urgent, but emergent PCI, this thing right here, this finding. So you can see the problem right there. We weren't taught about this. Nobody taught us this, which is really problematic. So in the end, okay, when it says non-specific ST2 wave changes, we need to look at all the leads for all the things, okay? And this is one of those high-risk patterns. So please burn this into your mind. I'm going to tell you what happened to her. I'm also going to tell you what the labs look like. And you probably would have came to a similar conclusion. But yeah, and so that's why I check egophony signs. Oh, nice. AVR is my best friend and nothing good happens in the V's per Michelle. That's so true. Latoya, I like how you're really making the most of this class and absorbing every little bit. I love that. So going on, here's what happened. They did some blood work in the emergency department. They did a thyroid. It was normal, because you want to think about, because she also had some lower extremity edema, you want to think about things like mixed edema. They did a troponin. It was negative. They did a glucose. It was 310. Her sugar was very elevated. She didn't know she was diabetic, AKA unknown risk factor, AKA her heart age is way older than 36, okay? And her BNP was markedly elevated. It was over 6,000. And if you're on the ambulance and you don't routinely deal with these, or in the primary care and you don't know this lab, it's what is a marker for heart failure. So this is very elevated. So she was in heart failure, which is why she had her effusion of her lung. And it was a left pleural effusion. It wasn't a pneumonia. That was a wrong read. But it's more, we get anchored, like Mike was talking about on night 3. We get anchored because she's 36 and she's coughing that it's got to be a pneumonia. Okay. So they did a CTA because Daisy was worried about PE, and obviously we all were too, right? And yeah, so Ronald said I usually get a right-sided and posterior 12 lead. I like that, Ronald. I like that you're being really super thorough. I'm a big fan of those. And her nuclear stress test showed that she had moderate to severe LAD occlusion and an RCA occlusion. Her ejection fraction was 20%. So what does she have? She has multi-vessel disease with a depressed ejection fraction, which means she's going to need what? What does this 36-year-old female need? Yes, Tehan. I hope I'm saying your name right. Yeah, absolutely a cabbage. Absolutely a cabbage. Okay. So you are right. And she did get a cabbage and a life vest. I love that you said that, Leanne. Teon. Okay, Teon. Yeah, so good pickup. And then we have lots of folks, including Jermaine, back in the house, and Denise with saying cabbage. So what the heck? How does, oh, you were CV surgery before, that's why. So, and possibly an LVAD. Yes, Ronald, you should hook up with Michelle if you want to talk about LVADs. She loves to talk about LVADs. So how does a 36-year-old female end up with multivessel disease? Well, the glucose of 310, longstanding uncontrolled diabetes. And she also had, unknowns to her, she had familial hyperlipidemia. So her heart age was pretty advanced. And with that in mind, that's my biggest take home for the whole challenge, is when you see your patient, think about their heart age, not their chronological age, because if they have significant risk factors like this, they can have early disease that we need to catch. So when you see your next cough patient in the clinic and you're like, you're 36, it's probably COVID, it's probably pneumonia, it's probably. think somewhere in the back of your mind about the zebras, because they do happen. This lady was an exact case of it. So she did get a cabbage, but she lived and she's actually doing great now. So luckily it was caught. But I asked the provider later, I said, hey, would you have gotten the EKG on that lady that came for pneumonia? And he goes, no, I wouldn't have. And you know what? It's hard to Monday morning quarterback that, right? But thank God that somebody did. Thank God that the nurse thought about it and did it and saved that patient's life. I'm a firm believer that would have slipped by and she could have went into cardiac arrest. Yeah. So at the end of the day, there is a lot of clues on the EKG if you know what to look for. That's why we've shared this 5 nights of high-risk EKG findings with you, because hopefully you'll feel like you're armed and ready to go find them. Now, when I was sitting back as a paramedic, and I remember that day, I showed you on day one, I showed you me in my paramedic jumpsuit back. I miss being a paramedic so much. I will just admit that. But I remember also being scared of like, oh my gosh, there is like so much responsibility. There's nobody but me out here. I have to figure out all the things, right? And I said, okay, well, how am I going to tackle this? What am I going to do to not miss this and not kill somebody? So I said, okay, I'm going to know the 2 things that kill young people. That's Brugada and hokum. We covered those last night. If you want to go back and review those, check those off your list, as now you know what they are. The non-specific ST2 wave changes. I sat down and wrote a list of those things. There's 6 things, okay? Over 30, Robert says, get a 12 lead. Yeah, I agree. Low threshold for 12 leads. Subtle ischemia is very significant, okay? Subtle ischemia. We need to know how to find that. Stuff that doesn't meet STEMI criteria, but is still significant for occlusion. We need to know that, because if we see that in primary and we're like, oh, it's non-specific, you can follow up with, cardiology, and it takes a couple weeks, that patient could die and you would be the last provider to see them. And that's not good for your license, good for your livelihood, or good for the patient. You also need to know how to pick up 2-to-1 flutter that you think is sinus tach. There's lots of different tricks we can show you on that. But if you don't anticoagulate that patient and they go home and have a stroke and you thought it was sinus tach, that's also bad. So these are the things. I wrote all these down. It was like PE, how do I pick that up? Hyper K, what are the 5 things with hyper K? I wrote all those down. I wrote down all the STEMI mimics so I wouldn't falsely call it ER and be like, hey, I've got a STEMI, like I showed you on night 1. That was a pericarditis. If you want to go back and watch that, it's the end of the session. So I wrote all these down and then I memorized those patterns. And that's where, if you were to ask me, Jen, I'm still learning these EKGs. I still feel stuck. Where should I spend my time? I don't have a lot of time. Where should I spend it? This is where you should spend your time, right here on this list. Okay. Learning these things so that you don't let anybody slip through the cracks and go home and have a bad outcome. I got to tell you guys that I feel this in my heart, that our medical system is broken. And I also feel that we're going to be the ones that are going to help turn it around, because if not us, then who? Right? So it has to be us. The onus is on us. So here's that list. Now, if you have appreciated the last 5 nights, type a hashtag yes in the chat for me. Super, super grateful that you have all been here. Taeyeon, yes, she does need a life vest. I totally agree. You are right up my alley. You have no idea. Okay. Yes. Okay. Lots of people. So Shirley, type in the chat if you want to ask a question. It looks like you raised your hand. But yeah, so hopefully you guys really got something out of this. Hopefully, you learned a systematic approach for 12 leads. Hopefully you learned about the waves. I'm hoping that you learned some high-risk things that you can put back into action. And these recordings will be up for you to rewatch, of course. I know some of you are probably going to be rewatching on the weekend. Yes, oh, Bindu and Patricia, thank you so much. And James, Ronald, and everybody, Jen, for being here. I'm going to give away the badges. And then if you want to stay on, I'm going to tell you guys a little bit more about the 30-day EKG challenge for anybody who's interested. But I want to give away the badges. So if anybody's planning on not joining us, you guys can go. CEU instructions. Okay, so the CEUs are there's a link in the featured post of the group that has the post, and you just click on that link. It's a Google Drive doc, yes, Ashley, thank you for reminding me. Google Doc, you click on it, it has a post test and an evaluation. You fill those out, and then we send you your certificate in the email. Make sure you check your emails, because sometimes they get sent to the spam. A lot of people get sent to the spam for some reason. So check that. And if you haven't gotten it within like a week, let us know. Ashley, yes. we are going to do a bonus course tomorrow because you guys asked for it. We're going to do a bonus session tomorrow at 4:30 Pacific Standard Time. So yeah, it's over the 5-day EKG challenge, but we're going to do a little bonus snack tomorrow where we'll come back with fresh eyes. We'll come back with a little bit of rest under our belt, have a good day tomorrow, go hiking or whatever. And then we'll meet back tomorrow night and have a little bonus sesh. Okay, thanks for reminding me, Ashley. I really appreciate it. Remy is in here trying to play ball. So I'm going to give away the badges. I think one just fell on my head. This person really wants to win. This is Deanne. Deanne, apparently you really need a badge. So Deanne, I know you're in our 30-day, but can you please send me your address again so I can send it out? Yes, Deanne, congratulations. Let's see who else is winning a badge. We also have Zulima. Zulima, you're also winning a badge. So I know I have your address, so no sweat. Jermaine, yes, celebrating. I love it. Jermaine, you're amazing. And also the other badge winner is Jen. So Jen, our cath lab nurse, you actually could really get a lot of use out of this, right? So here's our 3 badge winners. Congratulations. So excited. Penny, you need one. You can totally get one. You can get one on Amazon. I think they're like $9. They're called RCAT windows or RCAT window badges. And you can get them there. No worries. So that was our giveaway for the night. And again, thank you guys all for being here. If you feel like you got enough, feel free to wrap up the challenge, go have a good night. But if you want to stay and learn more about our 30-day, I'm going to tell you guys a little bit more. And then tomorrow, after the bonus, I'll show you guys inside of our exclusive Facebook groups that you get access to, just so you guys can have a peek. But in the meantime, what I wanted to tell you is that we did cover these things in the beginning. Okay, we covered those in the beginning of the 5-day. But what we do now in our 30 is we just continue taking you on the road so we can get you fully there. The 5-day is not enough to get confident. It's just literally, it's a smattering of things that are cool and wonderful and great to know, but it's not the full picture, right? We actually end up starting you back here, night 1, which is Monday. And we actually go even before that and we do EKG terminology. So you guys know the terms. And then we continue on with what a normal EKG looks like. Wednesday night, like Michelle said, she does the 12 leads. What does each lead look at? And she's very visual. Michelle has tons of classes that she's already done on coronary anatomy, right? And then we keep going with high risk patterns and we teach you all of the things. And we do this within the first 2 weeks, but it's all recorded. You can actually already watch it now, believe it or not. It's already up. We've actually been doing these classes for over 2 years now, and we have all the recordings in the 30-day for you already. But here's what you can expect if you join. So you can expect to go from I hate EKGs all the way till I love them. I know it's possible. I noticed that Erin Atkinson just came on. Erin's in our 30-day, so maybe you can, or if you're on Zoom with us, drop a comment about the 30-day, anything that you find that has been valuable, just so other people can hear it from you, not just me. But we do basic terms, basic EKGs, basic rhythms, and then we have practices for all of these in our 30-day challenge. So you get the class, but you get the practice too. You get study halls with the coaches, and one of our cardio NP queens, we just talked today, she's putting together a study hall based on questions that have come up over the past month. And she's going to customize a class. Okay. And that's coming up probably in February. We also have a bunch of live classes, and then you get 6 months access. Yes, Denise, best investment I ever made. We love you, Denise. But literally you get 6 months access to absorb all the things, but then that's okay. If you want to stay in longer, we can extend your stay and you can stay another year with us, and we go year by year. You can stay for life if you want to, but we're not going anywhere. We're just gaining steam, right? And that's exciting because our community is filled with supportive people that love doing these classes with us. And a lot of them have ended up teaching for us. So that's pretty cool. Are the 30-day? Yeah. So Michael, are the 30-day sessions CE hours? Yes. So how it happens. I know you did join for the year. I know, Nicole, I actually put a celebration graphic in our group today about you. But yes, there are CE hours. There are 12. And thank you for reminding me, Michael. Yes. So once you sign up, you get instant access to your learning portal, which is not on Facebook. And you can do all of those classes because they're in the recorded session. You can just watch them like tonight and get your CE hours by tomorrow. If you wanted to, you could, not that you would, but it's based on 12 hours that are not all here, right? Because we we wanted to give you basically access to a lot of live things, but also we wanted to make the CE stuff already recorded so you could do it on your own pace. So you, even if you decided, like, for example, to do the CE later in the year, right, you could. You wouldn't have any pressure on that. Okay, Zulima, I'm working some of these classes. They are recorded. Yes, the only thing that's not in the whole challenge is this on the 24th, which is Gary, who came on Tuesday and did the basic 12 lead, or sorry, the basic arrhythmia. He does a 12 lead version for us, and he doesn't allow us to record any of his stuff, but everything else is recorded. And it gets stored in the Facebook group, and you can go back and watch it. And so a couple of people who joined last night were like, hey, I really want to know about stress tests. So we tagged her in a bunch of stress test lectures. There was a medic who came in and wanted to know about med math. I tagged him in the med math lecture. So there's a lot of things that have already been done, a lot. This is just what we're going to be doing live, okay? So you get access to everything for the past 2 years, which is kind of cool. But we have guests come on too. I didn't mention that. We have lots of guests that come on and do different bonus topics for us. Like Sunday, we're going to have Carissa doing obstructive sleep apnea, who's our sleep queen. And then we officially kick off this cohort of our 30-day challenge on Monday. We're going to do EKG terminology, and I'm going to show you around the group and how things work. But basically, it's just like this, only for longer, and you get more of us, right? And then David, who's our EKG guru, he's our EMS, we call him our Mandalorian. That's why Michelle put him in our game. He does study halls for us where he takes all the things you ask and makes EKG classes just on that. So like, let's say you join, you could type in our 30-day group, David, I want you to cover left bundle branch block, please. He will make the class on left bundle branch block. There was some medics that just joined and they said, David, we want some cardiac farm for EMS. He's going to do that class now. So that's kind of how we work. We customize our some of our content as we go based on what you need, which is really cool. Who else is doing this? Is there anybody? Because I don't know. And then Michelle, she does a basic 12 lead class, which is epic. Again, recorded if you're working or you have something going on, but that's a really hands-on visual for you. Then we do basic arrhythmias. And then on the 21st, that's when you're going to need the kit I'm sending you. Okay. So even if you decide to join like the 10th or whatever, and you're like, I want to wait till next week, you can. You don't need the stuff in the box until the 21st. That's when we're going to go over together all of our hands-on stuff. You'll have the crayons, you'll have the workbooks and everything, and we'll go over it. Now, the 23rd, I'm doing something called study hall, where I come on and we are going to talk about differential diagnoses, because it's one of my favorite things, how to document to keep yourself safe, how to think about how you're going to work up a chest pain, and how to look at things like that. So it's a very customized course. Then we have Gary. So I'm glad you're available, Zulima. More David study hall, different content. I'm going to do a chest pain cases. And then February, we're still going. We're still going. Okay. And this is, we have John Kelly. She's a CHF PA out in the East Coast, been doing CHF for like 20 years. And she even works with VADS. And very advanced cases, but she's doing a CHF case lecture for us on the 1st. She's already done a couple, they're recorded, they're so good. We have our lipid queen coming on. She'll be coming on every month for the next till May. Actually, we have her scheduled all the way through. Every month, she's going to be doing lipid cases. And she, in case you need lipid help, right? You can submit questions and she will go over a case. I submit cases to her all the time. Then we also have an insomnia expert coming on. Like, we've got so many fun things planned. More David study hall, Carissa talking about pulmonary hypertension, and then of course David study hall, because he's coming on every other week for us, which is just a gem. I can't even explain to you. And then we're going to have our medic Sean come on, and he's going to do a rhythm course for you where you're going to practice with him. So that's what's coming just in the first 2 months. Of course, it's going to keep going after that, and you'll have access to that as well. And you'll have gotten in when the price isn't raised yet. So we have tons of classes, and Erin did a lecture for us. Oh my gosh, it was so good. And she's going to do another one on antiarrhythmics, which I can't wait for personally. But you have access to all these, including how to use the new drugs, how to make echo reports make sense, how to answer triage messages. So we have a lot of new providers that join, and they just need help on like, how do I navigate life? And so Megan, our cardio NP, is going to do a whole session on like being a new PA or NP. How do you do this? And it's going to be kind of cardiology themed. But you're going to get this kit that has all the good things in it. You're going to get access to all these courses. You're going to get a free painting made by me. while supplies last. You're going to get this workbook, the crayons, and of course, we're going to give you access to 2 Facebook groups. Now, somebody asked me what the Facebook groups were and what the prices were. So I'll tell you the Facebook group in a second, and I'll show you those on tomorrow. It's already Saturday tomorrow, but here's the prices. So let's just say money's tight for you right now, and you're like, yeah, I really want to do this. This sounds super fun, but funds are kind of tight. You can join as a student, even if you're not a student. You just don't get CE with it. Okay, you still get the kit, you still get all the access for $127, which is a friggin' steal. And we did that because we wanted to basically make it accessible because we really want you guys to win. We really, really want you to be good providers. EMS can get in for $149 with 12 hours of CE. RNs $199, 12 hours of CE, and PPAs $249 with 12 hours of CE. So this is a super, super awesome time to join. There's so much good stuff coming. And I think that is it. So anybody on FB or Zoom have any questions? If not, I'll be around, even if you're too shy. I'll be around tonight answering messages and getting more kits made. We make them as you guys buy them and we send them out. So it's super fun. And yeah, I think that's it, you guys. So did anybody have any questions, Michelle? Did you see any? I don't think I do. I don't see any in the Zoom chat. Okay. All right. So who is going to be joining us in the group? Like we have Latoya, we have Zulima. So loving your energy. Can't wait to just rock it with you ladies. And I hope that you come on Zoom so we can chat. And Denise is here. Hearts back to you, Denise. And also the other thing too is when you join, make connections in our group. We have like Denise, who's ICU RN, right? CBICU, I believe, Denise, right? We have a lot of medics, ton of medics. We have lots of nurses. We have lots of cardio NPs, PAs. We have a lot of urgent care. So make connections because everybody in our 30-day group is nice. Everybody. There's no cliques. There's no weirdness. It's just like, come on in with open arms, right? Because if anybody, and nobody's like that in our 30-day, but if they are, I'm like, here's your money, go away. We don't want your energy. We want just good people in here. Because ultimately, at the end of the day, we want to provide a supportive environment for you guys to feel comfortable to ask questions because there's no dumb questions. And Michelle will tell you that too. Okay, awesome. Yay. I don't think there's any questions, but if there is, tag me or Michelle. If you still need replays, let me know. We'll have a replay link that I keep posting in the group for you. And Denise says she never feels stupid. I know. We love that. Okay, Taeyeon, hope to see you around. Michael too. And Michelle, thank you for the game. I can't believe you made a new one for us. That was pretty amazing.
That was fun. I enjoyed making it. This was different. So next time I'll even have it'll work a little bit better.
Okay. Next time we'll get the bugs out. I like it. All right. So thank you guys all. See you tomorrow at 4:30 for the bonus if y'all are coming. And otherwise, I'll be seeing you guys hopefully in the 30-day on Monday night for our welcome call. And I'm going to go put some more kits together and get them in the mail. I know John's like, you're crazy. Are you the post woman? I'm like, no, this is fun, John. Anyway, you guys are awesome. Thank you, everybody. And we'll see you tomorrow. Okay, bye.